What is peptic ulcer? The other names of peptic ulcer: reasons, signs, treatment, precautions, and tests required to identify peptic ulcer. A peptic ulcer is a sore or lesion that develops in the lining of the stomach, lower esophagus, or the first part of the small intestine, duodenum. It occurs when the protective mucus layer is compromised, allowing stomach acid to damage the tissue. Other names for peptic ulcer: gastric ulcer, when located in the stomach; duodenal ulcer, when located in the duodenum; stomach ulcer. Causes of peptic ulcer: Helicobacter pylori, H. pylori, infection, a common bacterial infection that weakens the protective mucus layer; nonsteroidal anti-inflammatory drugs, NSAIDs. Overuse of medications like aspirin, ibuprofen, and naproxen; excess stomach acid production, often triggered by stress, certain foods, or medical conditions like Zollinger-Ellison syndrome; smoking and alcohol. These irritate the stomach lining and can exacerbate symptoms. Spicy foods do not directly cause ulcers but can aggravate symptoms. Stress can worsen symptoms or contribute indirectly by affecting eating habits. Signs and symptoms of peptic ulcer: burning stomach pain, commonly felt between meals or at night; nausea or vomiting; bloating or feeling of fullness; heartburn or indigestion; weight loss without intentional changes in diet; dark, tarry stools, indicating bleeding in the gastrointestinal tract; vomiting blood, may appear red or like coffee grounds. Tests to diagnose peptic ulcer: endoscopy, EGD. A thin, flexible tube with a camera is inserted to visualize the ulcer directly. H. pylori tests: urea breath test; stool antigen test; blood antibody test; barium swallow X-ray, to outline the ulcer on imaging; stool occult blood test, checks for hidden blood in stools, indicating gastrointestinal bleeding; biopsy. If an ulcer is detected during endoscopy, a tissue sample may be taken to check for H. pylori or rule out cancer. Treatment options for peptic ulcer: medications, antibiotics, to treat H. pylori infection, e.g. amoxicillin, clarithromycin; proton pump inhibitors, PPIs reduce stomach acid, e.g. omeprazole, lansoprazole; H2 receptor blockers, lower acid production, e.g. ranitidine, famotidine; antacids, neutralize stomach acid; cytoprotective agents, protect the lining of the stomach, e.g. sucralfate, misoprostol. Lifestyle changes: quit smoking and limit alcohol consumption. Avoid NSAIDs if possible or use with protective medications. Surgery: rare cases for complications like severe bleeding, perforation, or non-healing ulcers. Precautions to prevent peptic ulcer: limit use of NSAIDs, use alternatives like acetaminophen if needed. Manage stress through relaxation techniques or therapy. Avoid excessive alcohol and smoking. Eat a balanced diet and avoid overly spicy or acidic foods if sensitive. Practice good hygiene to reduce the risk of H. pylori infection. Regular medical checkups, especially if you have risk factors like a family history of ulcers. Peptic ulcers are treatable, and early diagnosis helps prevent complications such as perforation, severe bleeding, or obstruction. If symptoms persist, consult a healthcare provider promptly.
Thank you for watching. Please like, subscribe and share our channel, The Amused Notebook.